The nursing process is a systematic, patient-centered approach used by nurses to provide individualized care. It consists of 5 interrelated steps: assessment, diagnosis, planning, implementation, and evaluation. Assessment: collecting comprehensive data about the patient's health status to establish a baseline and identify patient needs. Steps in assessment: data collection, subjective data, what the patient reports, for example pain, nausea. Objective data, observable and measurable signs, for example vital signs, lab results. Methods: interview, collect patient history and current complaints. Physical examination, inspection, palpation, auscultation, and percussion. Review of records, medical history, diagnostic tests, and previous treatments. Collaboration: input from family and other healthcare team members. An example of assessment: a patient with colorectal cancer might report abdominal pain and fatigue. It's subjective data. While their vital signs show fever and weight loss, it's objective data. Nursing diagnosis:
analyzing data to identify actual or potential health problems. To develop nursing-specific diagnoses that guide interventions.
Types of nursing diagnoses: actual diagnosis, current problem, for example acute pain related to surgical incision. Risk diagnosis, potential problem, for example risk for infection related to surgical wound. Health promotion diagnosis, focus on improving health. For example, readiness for enhanced knowledge. Example of nursing diagnosis in a colorectal cancer patient. Diagnosis: imbalanced nutrition, less than body requirements related to reduced appetite and chemotherapy side effects. Nursing planning: setting goals and outlining interventions to address the diagnosis, to create a roadmap for care, ensuring measurable and achievable outcomes. Steps in planning:
prioritize diagnoses, use tools like Maslow's hierarchy of needs. Set goals, include short and long-term goals, SMART, specific, measurable, achievable, relevant, time-bound. Develop interventions, evidence-based nursing actions tailored to the patient.
Example of nursing planning: the patient will maintain adequate nutritional intake by consuming 70% of meals daily within 1 week. Nursing implementation: executing the planned interventions to achieve the identified goals and improve patient outcomes. Steps in nursing implementation: direct care, actions involving direct interaction. For example, administering medication, indirect care, actions performed on behalf of the patient, for example, consulting a dietitian, documentation, recording interventions and patient responses. Example for colorectal cancer patient:
administer prescribed antiemetics 30 minutes before meals to reduce nausea. Educate the patient about dietary modifications to manage diarrhea.
Nursing evaluation: determining if goals were met and revising the care plan as necessary to assess the effectiveness of interventions and ensure continuous improvement. Steps in evaluation: compare patient outcomes with expected goals. Identify factors influencing the success or failure of interventions. Modify the care plan based on the findings. Example: outcome: patient's caloric intake increased to 80% of daily meals. Adjustment: if goals are unmet, consider consulting a nutritionist or revising meal options. Summary: the nursing process ensures holistic, evidence-based, and patient-specific care. It is a dynamic cycle, requiring constant reassessment and adaptation to meet patient needs effectively.